everybody. I hope you are doing well. I am here today to discuss to you the nursing care assignments. Now, in my presentation, I will not be able to give you examples because at the end of the presentation, we are going to ask you to participate in the online forum. And I prepared here some points for you um, to guide you. Now, the discussion will be focusing about your experience with SQH and other hospitals in MOH. Share to us the observation that you have on what nursing care assignment are they using. For example, in SQH, they assign one nurse to do the medication from the start of the shift until the end. This is an example of functional nursing. It is good because it reduces medication error. So you can also include in your discussion the benefit of the different types of nursing care assignment that you observe, as well as also the disadvantages. You can also include that. Now, after you shared your experience in the online forum, um, from your input, instructors will be there to engage you in discussion and so on and so forth. And also, if you have questions, clarifications, you can do that in the online forum. Sharing of experiences is not limited to only one, so you can share as many as you want for your online participation. Okay, let's move on. Um, Case method as a nursing care assignment. Here, each patient assigned to a nurse, which will do in return a total patient care. The patient will have a different nurse with each shift, one staff member, the patient care coordinator. Usually, the head nurse or senior nurse supervises and evaluates all care given. This case method nursing care assignment is usually one nurse, one patient. Hence, you can see this in ICU, but it's not only limited to ICU. Um, it can be extended to two patients sometimes or more, depending on the situation, but mostly it is 1:1. All right. Now, do not confuse yourself with case method to case management because case management as a nursing care assignment is a collaborative process of assessment, planning, facilitation, care coordination, evaluation, and advocacy for options and services to meet an individual's and family's comprehensive health needs through communication and available resources. And this is to promote quality, cost effective outcomes. You can see sometimes in a hospital, like in SQH, we have specialist nurses dedicated only for wound care or diabetes or genetics, right? Other points or examples we will be discussing in the online forum. So I hope you are not confused between case method and case management. Now we'll move on to functional nursing. In functional nursing, different tasks are assigned to different nurses. Example, medication, wound care, vital signs, etc. Single task is performed for all the patients. Now, in functional nursing, care tends to be fragmented and depersonalized because different nurses will be assigned, say, for example, to one patient. So it is fragmented. But the efficiency and division of labor and rigid control are emphasized. Meaning to say, since this is what your only this is what you are going to do only from start of the shift until the end, then the accountability is very clear, which again we are going to further discuss in the online forum. It is the least costly method and requires few registered nurses. Hence, in times of crisis where there is shortage of staff nurses and staffing is critical, the functional nursing is the best way to go. It allows registered nurses, staff nurses to perform managerial and non-nursing duties as well. Now, in primary nursing, this nursing care assignment is based on the philosophy that patients instead of tasks should be the focus, and total patient care by the nurse can be done up to maximum of 6 patients, but not more than that. The primary nurse remains responsible for the care of those patients 24 hours a day throughout the patient's hospitalization, whether the nurse is on duty or not. So even if the primary nurse is not on duty, this nurse is still accountable to this patient. How is that possible? Now, um, the reason why it is possible is because when the primary nurse is out of shift, another one will take the place of the primary nurse, sort of a secondary nurse. This secondary nurse is what we call as the associate nurse. The associate nurse cares for the patient by using the care plan developed by the primary nurse while the primary nurse is off duty. So all that the associate nurse will do is to follow the nursing care plan that the primary nurse did. The associate nurse is expected to contact the primary nurse regarding changes in the care plan. Further discussion, we will do that in the online forum. Team nursing. Team nursing is based on philosophy that supports the achievement of goals through group action. Mostly team nursing is done when there's a group of people that includes a team leader, nursing assistants, um, student nurses. The team is led by a professional nurse who plans, interprets, coordinates, supervises, and evaluates the nursing care. Team leaders assign team members to patients by matching patient needs with the staff's knowledge and skills and do the work that other members of the team are not qualified to do. Team, mem- Team members report to the team leader who reports to the patient care coordinator or unit manager in charge. Modular nursing. Modular nursing uses smaller teams for patients who are grouped geographically. So, modular nursing is based on locations or geographical location. It is also used when there are not enough registered nurses, staff nurses to practice primary nursing. The registered nurse plans the care and directs the paraprofessionals for the more technical aspects of care. The RN's role is closer to that of a coordinator and information processor than that of a charge nurse. Examples, again, we're going to discuss in the online forum. So, my dear students, if there are clarifications or any ideas, we are going to do that in the online forum. So, I hope um, you'll be participating, and we encourage you to share your experiences. And in return, clinical instructors will be there to clarify any doubts. That's it. Stay home, stay safe, and I'll see you in the online forum. Thanks.